indeed also to appreciate and recognize.
The Ministry of Health and other health stakeholders have identified a pilot program in Kiambu health facilities that receiving COVID-19 care by clients regular health provides leads to treatment retention. With integration, it improves ownership at the facility level, which in turn minimizes incomplete referrals of positive patients.
Happening at primary care level, that you can be able to do the diagnosis at primary care level. And again, as a government, that is our thinking, that the way we have delivered healthcare service in this country since independence has been top down. But at the bottom of the pyramid, where people seek services, we have underinvested over a long period of time.
As women, children, and immune-compromised patients with HIV or tuberculosis are more likely to develop severe disease and or death. During the pilot program, it was paramount to ensure these key populations have their conditions managed in a comprehensive way. Patients have been receiving COVID-19 screening, testing and treatment services as part of their routine care.
We are integrating this testing where you find a patient coming for TB clinic is screened for diabetes, for HIV. So one of the things it has helped us in active case finding for COVID-19, TB, HIV patients.
We had some isolation centers just for COVID, but now this was just for the emergency. But moving forward, this was not sustainable. COVID-19 can be integrated within the health system, even you reduce the stigma.
So similarly, COVID being a new disease required new tools. And some of these tools existed, but for complex treatments.
The launch of the drug tocilizumab, for which a serious patient of COVID-19 would have to pay 300,000 shillings, has brought relief into the country, as 1,470 doses have been sent to the nation of Kenya by the WHO and received in the country on 20th of May 2022 to treat serious victims of COVID-19 for free of charge.
And one of the key milestones, of course, was the use of tocilizumab, a very tough name, for severe COVID disease. Of course, the ministry facilitated this by providing emergency use authorization through the Pharmacy and Poisons Board, because most of these medicines have not been registered in the country.
But when you use this tocilizumab, we realized that the use of oxygen was even less. Patients would stay in the hospital for a very short time, and more so we saved very many lives. This treatment is still available, and we are able to provide across the country for free.
The integration model has also made use of electronic medical data, ensuring that data is captured real-time for effective patient management and follow-up through the electronic medical records. Overall, 17,336 attendee visits were reported in the test all-arm and 14,665 attendee visits were reported in the screen and test arm. In the test all-arm, 73.2% were screened for COVID-19 symptoms, while 17.4% were tested with a positive rate of 1.1%.
So in terms of investment, we also want to flip the pyramid, invest more at the primary healthcare level, where this project was implemented and where results clearly show that this can be able to work at primary care level. But based on this evidence from this study, which I would recommend that we replicate and scale up throughout the 47 counties, so that we can be able to reap more dividend.
Ministry of Health Director General Dr. Patrick Amoth has urged the government to learn how to prepare for disaster by using best practices from the outbreak of Ebola and how the nation countered the outbreak of the disease.
You saw what happened during the Ebola outbreak in Uganda, an outbreak which ended about a few weeks ago, because we also have significant lessons to learn from them. How they are able to bring a pandemic of that magnitude to a control within such a short period of time, more so that it had reached the capital city, Kampala.
For Ebro TV, Amode Francis.